Hello, my name is Lastra. Topic: Nonalcoholic fatty liver disease, insulin resistance, and ceramides. Definition: Insulin resistance is a precursor to an accelerated of coexisting conditions such as type 2 diabetes, atherosclerosis, and non-alcoholic liver disease, and recent study of mouse models implicate elevated levels of ceramides and their effect on mitochondrial function in the mediation of cellular insulin receptors.
My name is Dr. Bloom. I'm a physician at the Massachusetts General Hospital Liver Center, and today I'm talking about non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is the buildup of extra fat in the liver cells that is not caused by alcohol. In some patients, this fat causes the liver to be irritated or inflamed. Long-term inflammation of the liver can result in the development of scar tissue, which we call fibrosis. In some patients, this can even progress to cirrhosis, which is advanced scarring of the liver. Fatty liver disease affects nearly 30% of Americans. It was historically thought to be of little importance, but fatty liver disease is one of the top reasons today for liver transplant in the United States.
Application is nursing. Give an educational talk to the patient, accessing the person's way every 15 days, educating about the importance of a healthy diet, helping to reduce the intake of unnecessary calories, give indication, treatment, administer medications, motivate the patient, perform physical exercise, monitor vital signs, monitor the patient for further symptoms.
Well, I want to thank you for joining our team meeting here at Advanced Liver Therapies, a research unit dedicated to clinical studies of new therapeutics for patients with liver disease. It's important that we meet as a group because we have several studies now to treat non-alcoholic fatty liver disease. And you know that non-alcoholic fatty liver disease. Well, let me take a look at some of the slides and things I have here, because I think I've got one that will answer that for us. Okay, what does non-alcoholic mean in the term NAFLD, non-alcoholic fatty liver disease? First, it doesn't mean that you do not drink at all. It does mean, however, that you do not drink enough that could cause alcoholic liver disease, and that is defined for females as more than one alcoholic beverage, be it a beer, a glass of wine, or a cocktail per day, and for males, 2 such beverages per day per week. Now, if that average is exceeded, you have the risk of alcoholic fatty liver disease and alcoholic steatohepatitis, totally different disease. So for NAFLD, you can either have no alcohol, if that's your preference, or if you do drink, as a female, you have to stay within the limit of 1 beverage per day, or males, 2 beverages per day, to qualify for that non-alcoholic term.
So, Dr. Beerling, what are the consequences for a person that has NAFLD or non-alcoholic fatty liver disease?
Well, here we kind of show as a cartoon the consequences. A normal liver is obviously what we would all want, but if a person does have steatosis, fatty liver, due to non-alcoholic fatty liver disease, they have already developed an excessive risk of death due to heart attacks, strokes, or diabetic complications, because fatty liver is part of a syndrome encompassing diabetes and hypertension and has that increased risk. Now, we don't know whether if you start out with simple fat, steatosis, whether you may progress ultimately to NASH. But we do know that some people right from the get-go have NASH. And that is a progressive disease, as we said, leading to liver cirrhosis. And unfortunately, even before you have cirrhosis, there may develop a risk, which is greater when you have cirrhosis, of primary liver cancer. Now, all of those mean that you can go into liver failure, have premature death, or require a life-saving liver transplant to survive.
So the consequences.
Pros and cons. Pros. No doubt of those one be small apple RNA could prevent but not reverse obesity in might. Perhaps augment mitochondrial function, brought about some suppression of the one improvised whole body glucose metabolism by reducing ectopic lipid and intracellular lipid metabolism, such as plasma membrane RN 1.2 diglycerol acetyl-CoA independent of weight loss.
Everyone is different. Your liver doctor will help you understand your condition and the healthy choices that can help you take care of your liver. This may include weight loss, exercise, and medications.
Cons. Various types of lipids are involved and molecular mechanics that affect the action of insulin are diverse.
Non-alcoholic fatty liver disease is more common if you are overweight, have diabetes, or have high levels of fats in the blood, like cholesterol or triglycerides.
Program applica en línea cuadra. And consequent sampling of 185 students was under from the Guayaquil Education Unit, and anthropometer survey was conducted, blood samples were taken, and an abdominal ultrasound was performed to determine non-alcoholic fatty liver levels. Non-alcoholic fatty liver prevalence was 37%. Anthropometric body mix in the population, height and weight circumference significantly increased in students with and non-alcoholic fatty compared.
So today I'd like to talk to you a little bit about non-alcoholic fatty liver disease, or what I like to abbreviate as NAFLD. Non-alcoholic fatty liver disease is when a portion of the liver cells become fatty. Oftentimes that's due to not being at your ideal body weight, so it is definitely correlated to obesity, insulin resistance, and diabetes. NAFLD is very common in the United States. Currently, there are 3 million new cases each year. Unfortunately, this disease does not just affect adults, but we are seeing it more and more in children as well.
So the reason why we're concerned about non-alcoholic fatty liver disease is you do have a portion of the liver cells that become fatty. Unfortunately, over time, if that fat causes inflammation and or scarring to the liver, it can lead to NASH, which is non-alcoholic steatohepatitis.
Conclusion. Dyslipidemia continues to be the most common risk factor important for the presentation of fetal liver. The insulin resistance has a high association with non-alcoholic fetal liver disease, and we propose its use for early detection of fetal and liver impatients with one or more MS factor, and especially when the hormone is greater than 5 times acceleration and growth of patients at higher risk. Although this has to be conformed with the expansion of the areas in the number of patients and with long-term follow-ups ideally with liver and biopsy.